Violent crime robs ordinary citizens of the healthcare they desperately need. This came out during the launch of the Violence Prevention Unit's Delft area-based team. Since the 1st of January until yesterday, over 6,250 trauma cases have been treated at public health centres in Delft. Of this number, 71% of the perpetrators, men and boys. The high numbers of violence-related trauma means that more often than not, citizens with non-trauma related health emergencies have to move down the list of priority at emergency rooms.
When crime levels go up, then businesses go away, investors stop investing, so then poverty jumps in again, and it just keeps on exacerbating. So if you can fix crime, you start to make a difference in the burden in your hospitals, because you're now only dealing with people who are coming to your hospital because they're sick. You're not dealing with people who come into your hospital because they've been stabbed or shot. Your businesses are not closing because they're worried about the extortion and the crime. They're flourishing. More jobs are being created, and so that's the issue. So if we can get safety right, safety enables better outcomes in general across the board for citizens.
Based on models from other countries, which uses data from healthcare facilities to identify and design crime prevention interventions, the Violence Prevention Unit is aimed at creating safer communities, lightening the burden on the overburdened healthcare system, stimulating economic growth and improving quality of life. The Department of Health and Wellness says its systems are in place for immediate reporting of violent crime trends.
We mustn't wait until it's a quarterly stats that will be released by the SABC in terms of what happened, because it's already late. So we cannot do some of the interventions retrospectively. Whereas for us, within 24 hours, it will show that we have got so many cases that have been assaulted or killed, because we also get the same data from our mortuaries, because it's unnatural death. So for us, it's about please prevent this immediately before it becomes late.
Recently released police crime statistics feature Delft in the top 10 list in the Western Cape for murder, assault and attempted murder. Locals say gender-based violence is also a big problem in the community.
Our aim really is to bring a partnership between communities, whole of government, whole of society approach to be able to reduce violence. So effectively, what we want to do with this area-based team approach is to bring a whole range of participants together to be able to respond to the violence that's plaguing our communities. We've got a lot of data that can help us understand where violent crime is happening, and we want to bring the law enforcement agencies together with our colleagues in the departments of social development and other departments to strengthen social protective factors, and all of that together in an area-based team approach in a geographic area.
Residents of Delft have welcomed the initiative, but they have appealed for more protection of the elderly and recreational facilities for the youth.
I'm very much impressed what they are actually doing, but most of the seniors, most of them is actually really suffering in this community, where the children is actually being abused. The children abuse their seniors. Some of the seniors doesn't sometimes want to talk about the things, but that's why I'm saying to them, we as a clubs, we are a family, and we must actually talk our grievances and our problems must we actually talk out to, in this community.
The area-based teams are groups of government and non-government stakeholders, including neighbourhood watchers and NGOs, working hand-in-hand with police and law enforcement and government departments to address the drivers of crime. 18 policing precincts have so far been identified for the establishment of area-based teams, including Mitchells Plain, Nyanga, Beaufort West and Theewaterskloof. Vanessa Poonah, SABC News, Delft.